Hi everyone, I'm Miss Chrissy and I'm here today to talk to you about your friend Ashley. As many of you know, Ashley has been gone for a few weeks and I'm sure you're all curious to where she's been and what she's been doing. So Ashley, a few weeks ago, had an accident at home where she burned her right hand and her inner thighs very badly. Now, I want everyone here to think about a time when they got burned or touched something really, really hot or even just got a sunburn. Think about how much it hurt, how long it lasted, what it looked like. They're not fun, right? Well, Ashley got a burn too, and it's a little more serious than those types of burn because it goes deeper into the skin. This isn't good and can cause a lot of medical complications, so Ashley's been at the hospital receiving treatment so that her hand and her inner thighs can heal and she can come back to school with you guys and function just like you guys, because this burn does not change her insides, it just changes her outside. So I want to talk to you a little bit about that. But before that, I want to talk to you about the treatment she's gone through and what she'll be doing when she gets back. So since Ashley's been at the hospital, she has been receiving treatment like fluids, because a burn like she got can really have medical effects where she loses a lot of fluids. So we need to replace those. Like, think about when you're outside on a really hot day and you need a lot of water. A burn does the same thing. So she also has been receiving special baths to help clean her hand and her thighs. And she has also been getting ointment like antibiotic or ointment on her treatment area so that they can heal better. Think about how you put on aloe for when you get a sunburn. That's the same sort of thing. It helps with the pain and it heals the skin. Ashley also got a splint in her hand to help stabilize it. Anyone who's broken a bone has gotten a splint. It helps keep your bone in place so it doesn't move and helps get the movement back in your hand so that it heals faster later. Ashley also will have dressing on her hand, which is a wrap. There's a dry wrap and a wet wrap. A wet wrap has the antibiotic cream in it, so it can heal more. And then after a while of that, you get the dry one, so it can help heal. She needs to have her hand and her inner thighs dressed very often. So this is something that will continue on when she's back at school. So you may see her wearing these wraps on her hand, or you may see her leave to change them. Ashley will continue to wear these because she had her surgery where we replaced the bad skin with good skin. And I do want to let you all know that this kind of surgery does leave scarring and will change how her hand and her legs look. Now, this isn't a bad thing, and I don't want any of you to think that. And I actually want to talk about burns a little more so that you guys can understand that it's not something that changes who you are on the inside, just your physical appearance. So we're going to do a little activity. I want you all to take a piece of paper and draw yourself on it. And then I want you to put your name and also 3 qualities about yourself that you like and think that you are. I actually did the same thing for Ashley. She told me what she wanted to have on here. So she wrote that she is kind, fun, and giving. And this is her, so I want you all to draw a picture of yourself. Alright, now that you're done, I want you to take that picture and I want you to crumble it up. I just want you to just completely mash it up. You can put some marker on it. You can tear it a little. Just kind of get it all crumbled up. Okay, now that we're done, we're going to uncrumble it. So, see how the picture of yourself is all crumbly and might have some marker on it and just just looks a little different now. It's not the same straight paper that we see, but I want you to also look at the person. They're still the same person, and I also want you to look at your qualities. Now, if you looked a little different, wouldn't you still be, like Ashley is, kind, fun, and giving? Even though it looks a little different, the same qualities of the person are still there. So that's where I want to get into, she is anxious and excited to come back. But we all need to remember that it's okay to ask questions about it, and that she's not a different person, and she is just the same kid inside and will want to play with you and be able to participate in class. So just remember that. So now that we've talked about that, I want to talk to you about what Ashley will go through when she comes back to class and what you might see and be a little curious about. Ashley will be a little late to class sometimes because she has physical therapy. Now, physical therapy is done for her because she needs to regain the same skills in her hand that she had before, where she can write and she can throw and anything you could do with your hand. These kinds of burns, they damage how the hand works, and we're just trying our best to make it be able so she can do the same thing she did before. So physical therapy is a little tiring, so she might come into class some days being a little agitated. She might be tired to do some of the same things, but that is perfectly okay. She also will need to have someone to write notes for her in class because it is her dominant hand. So we'll talk to the teacher about this, and maybe it could be one of you who could be her desk mate. So that might be something that happens. Just so you know, if you have any questions, you can also ask your teacher because she knows a lot about this, and we have talked to her. You can also ask Ashley herself because she is very open about it, and it's good to know a lot of this information. Now we're going to go ahead and do some activities in the back of the room. We're going to go to a mini hospital to look at some of the things Ashley has had treatment with and what you might see her wearing. But thank you for listening, and I hope that you have a better understanding of third-degree burns and what Ashley has gone through now.